Welcome to the nurses. I'm Bonnie.
I'm Melissa.
And we are the nurses. I'm Carol.
Today we'll be talking about coronary artery disease and the treatment and management of it. So you've been diagnosed with coronary artery disease. We'll talk about some of the management, such as stopping smoking, physical exercise, stress relaxation, and nutrition. And then we'll move on to managing CAD with medications. So as you can see that smoking can cause platelet aggregation and clots. Are increased in smokers, which leads to narrowing of the arteries. Here you can see a tear in the artery wall, which is caused by smoking. It breaks down the artery wall, and then that leads to fatty material accumulating, which then becomes blocked by a blood clot there. So in fact, smoking leads to lower HDLs, which is your good cholesterol, which we'll learn about more in the nutrition section. After a year of smoking cessation, the risk of CAD declines to a person who's a non-smoker. So quitting smoking will definitely increase your chances of leading a healthier lifestyle.
And the way that we remember, us over in the nutrition side, the HDLs are good. We call them the happy ones, H for happy. And we say the LDLs are the lousy ones, L for lousy.
Very good way to remember it. So ways that, as you can see, there's a graph there that shows how being a smoker strongly increases your chances of coronary artery disease, especially as you age.
So the risk goes up?
It does, in both men and women. So ways that you can help yourself quit smoking is going to a smoking cessation class. There you can receive positive support and help give you the steps needed to stop smoking. You can ask your healthcare provider for a referral to a class that's around your house. Cigarette smoking is a physical and a psychological addiction. You have to remember that you are in control of your addiction. So when you're trying to stop smoking, and you will get urges, but try to fill those with something such as exercise or something that you like, maybe like reading a book. You may get lightheaded or sleepy or have headaches for a few weeks, but if you are able to get through that, you could be a non-smoker. Another way that you can help yourself is to make a contract, which will remind you how to focus your goals and work towards stopping smoking.
So it looks like even if you are a smoker, even if you just cut down, you're already improving your heart health? Or do you have to quit totally?
Well, quitting totally will definitely help, but of course anything could be a benefit. Another way to help your coronary artery disease is to increase your physical activity. This will help you increase your HDL levels, which is your happy cholesterol, and lower your total cholesterol levels, which includes your
LDLs, the lousy.
Correct.
I think physical activity is great because you really don't need to push yourself.
Right.
You know, baby steps.
Although I think if you're riding bikes, you shouldn't be holding on to your husband's shoulder.
Yeah, I wouldn't do that. That could lead to other issues.
To each their own.
Maybe it's before they started pedaling. Maybe they're not actually moving now.
So physical activity can help increase your collateral circulation and vessel size, which will then lower your blood pressure and create an alternative route for your blood to travel. So you hopefully won't end up with a blood clot. Physical activity, of course, helps you with your weight, so it might help you with obesity if you are obese, or help you not become obese. It helps prevent and manage diabetes as well. They're all kind of interrelated. Some ways that you could be physically active is to take the stairs instead of the elevator, or walk in place during a commercial if you're watching TV. 30 minutes of walking a day. Then another way for your lifestyle change is to reduce your stress.
Easier said than done.
That's for sure, especially for the type A personality.
We don't know any of those two.
Type A personalities tend to be more aggressive because they're so ambitious. They're competitive. They have a sense of urgency. All of this creates extra stress. So stress results in the release of stress hormones that contribute to the workload of the heart and the cardiovascular system. So that increases your blood pressure. Stressed people are more inclined to not eat well or exercise and may smoke as a result of stress. So it's kind of a trickle-down situation. One bad habit leads to another. A way to deal with stress is to understand how you cope with it and decide if it's a healthy avenue or not. So you can change what you do to lower your stress. On here, there's a bunch of different things. Figure out what you like. So we have someone reading a book or listening to music. Yoga is a great way. There's walking, so that can be your physical activity as well as your stress reduction. You also should recognize that there are some things that you can't control, so try not to stress over that. Before you agree to do something, consider whether you really can do it or not. It's okay to say no. Stay connected with people you love, talk to them, get support from them. Make it a point every day to relax. We said read a book. And be active.
On to nutrition. I want to talk about some healthy ways to make some healthy eating choices. The changes you make can help to make your heart healthier. There are lots of reasons to make these changes, but mainly it's to slow the progression of your heart disease and lower your chance of having a heart attack. And we're going to reduce our LDL cholesterol, control our blood pressure, and maintain a healthy weight. All right, fruits and vegetables. Fruits and vegetables is a great way to improve your diet by adding these in. They've been shown to improve blood pressure, your cholesterol, your triglycerides, and they help to manage your weight. The goal is to eat 7 to 10 servings a day.
It seems like an awful lot.
It does seem like a lot, because you're thinking, I can't eat that many, but then you have to dial it back a little bit and remember that a serving is a half a cup. All right, so I brought my half a cup, and how many servings would you think an apple was? Well, we would think it would be one serving of fruit, but it's probably like a cup, so it would actually count as 2 servings. And the same with an orange, and if Melissa gave me her banana, which I know you have in your bag, that would probably be 2 servings as well. So you can eat them at every meal, and you're going for the 7 to 10 a day. Now, fresh and frozen are best. They'll have the highest nutrients because they haven't had time to get lost. But canned work too. Now, if you're going to eat canned fruit, you're going to pour off the juice so you don't have that extra sugar. And if you're going to eat canned vegetables, you have to worry about the salt that's in there. So the good way to get rid of half of that salt is just to rinse them in water.
That's a great idea.
All right, another thing we can do in our diet to help our heart is to eat more fiber, especially whole grain products. Fiber is going to help to lower our LDL cholesterol. Now, there is fiber in the fruits and vegetables, but our additional fiber that we're going to get here from our whole grain products, we're going to find in whole grain breads, whole grain pastas, as well as brown rice and whatnot. I know with my family, we were going to switch to whole wheat pasta, and I did it gradually. We would take what you normally would eat, and then maybe add some of this, and before they knew it, they were eating all whole wheat, and they really didn't miss it. In the beginning, I think if I had gone totally whole grain, they probably would have noticed more and complained, but because it was a gradual shift, it kind of worked out that way.
That's a great idea.
I think that's great for adults too, because not everybody likes whole wheat.
Oh, I did it for my husband, so he is an adult sometimes. Now, the other thing when we're going to talk about a heart healthy diet, a big part of it is our fats. Fats affect your cholesterol. So the unsaturated fats are your good ones, and they're the ones that are going to lower your LDL. And they're generally liquids, so they generally come from plants. You're going to find them in olive oil, canola oil, safflower oil, corn oil, all your vegetable-based oils. The other place that we find these unsaturated fats, avocados, nuts, peanut butters, almond butters, and seeds. Now, the fats we don't want to go to are the saturated fats, and they're mainly found in animal products. So your dairy and your red meats, and you want to use those sparingly. Now, the worst fats are your trans fats. And we don't want to have too many of those. Actually, we don't want any of them. And there's less and less of them as we, because of the new laws and regulations, they're not in foods that much. You have to look at your food labels, and you're looking for 0 trans fats. Oh, and another way to get the good fats is to use non-dairy. Well, if you're going to do dairy, do non-fat or low-fat. So try some low-fat yogurts, try some non-fat milk like skim milk, or some low-fat like 1%. Just give it a try, worth a try. So when you're talking about fats, a big way to do it is to eat more fish and lean chicken, and to have less fatty red meat. So I guess the recommended would be 1 to 2 servings of red meat a week. And a serving for meat, we all know it's about the size of your palm and the thickness of your little finger. And that's about the serving size for these foods. And salt.
That's a big one.
Salt is a big one because salt and sodium can raise your blood pressure. It's recommended that you eat between 1,500 and 2,400 milligrams of salt. And if this is a teaspoon, that is about 2,400 milligrams of salt. So that's what you're trying to get in your day. But salt is generally something, we don't put that much on our food when we generally shake. Where we get most of our salt is in processed foods. So, for instance, like this is something, it's easy, it's quick, my husband loves to make it because he can just dump it in, mix it in, put it in the microwave. But it's a processed food, and he is getting 32% of his salt in this. And if he eats the whole thing, because we all know he doesn't eat 1 serving, then he's getting half his daily allowance of salt.
And that's only a side dish.
And it's only a side dish. So one way you could make it less salty is to cook this, but then add in something with no salt. And as you noticed, it's also whole grain. So it would cut your serving, your salt in half in that serving. But the best way to cut down your salt is just to make things from scratch and not get the processed foods.
I've heard that just walking around the perimeter of the grocery store is the best way to get the fresh foods.
Fresh fruits and vegetables, and then produce and meats. Yep.
And I know I really watch my salt intake, but the one thing I can't get away from is the bread, because you pretty much have to buy bread. So if I know I'm going to have salt there, then I try to keep away from it in my other ones. But there's lots of great products now, like I do use some canned vegetables, especially diced tomatoes, but now they make no salt added. So this actually only has 1% of my salt for the day, which is great. And now they even started to make some low salt beans. So if you look at your labels, you can do it.
Always check your labels.
Portion is a big deal, and my plate is nice. And I think when you're just starting and you're trying to eat healthy, it might help to think of this. If you fill your plate up halfway with fruits and vegetables, a quarter with your protein, and a quarter with your starch, you're pretty much going to hit that 7 to 10, and you'll be in your things. And I added my dairy. You don't want to forget your dairy. And I just tapped it twice, continue twice. Don't forget your breakfast and lunch. You can do the same thing. You might want to add fruits for breakfast instead of vegetables. Lunch, you might want to do it all. But once again, it's kind of like half fruits and vegetables, a grain, a protein.
Breakfast is the most important meal of the day.
It is. And they say you should eat your breakfast within an hour of waking up. And then eat your other meals like every 4 to 6 hours after that. If you're not going to hit a meal 4 to 6 hours after that, then you try to have a nice healthy snack. Of course, we would go to something like fruits or nuts, something without no saturated fats and without sugars and salt. I just came across a study that said if you can get your partner to go in on these healthy eating and I guess healthy exercising, your chances of staying with it after 6 months rise dramatically. So if you're thinking of making some healthy choices, that's what I wanted to say, then definitely get your partner to join you and tell them all the benefits and how it's going to improve your heart health and prevent heart attacks. And it should go a long way. So to sum it up, the best foods for older adults, you want to eat brightly colored fruits and vegetables. And my deal is you just try to use as many colors a day as you can. Try to some whole grains, add them in slowly. Try some low or non-fat dairy. Move to lean animal protein or even some vegetarian protein, your beans and your lentils. If you really miss that salt, try alternate spices or lemon juice or vinegars. Try healthy oils. If you're using unhealthy oils, just switch to liquid vegetable oils. And don't forget to have your dairies and your liquids.
All right, now we're going to be talking about medication. Now, obviously, it's more important to do the diet and exercise. Those are some things that you really should focus on. But, when you get to a certain point, you're going to need some kind of, medication to help. The most common types of medication that people with CAD use are antianginals, lipid-lowering agents, antiplatelets, antihypertensives, smoking deterrents, and anti-diabetics. But what are all of those words? First, we're going to talk about antianginals. So, to understand what an antianginal is, you should know what angina is. So, angina? We all know angina is like a tightening or like a squeezing in your chest. Makes it very uncomfortable.
Elephant sitting on your chest.
Yep. That's due to decrease in oxygen going to your heart. So, what your doctor is going to give you are these. So, what are they? Medicines that help to relieve angina. And how do they work? They work by widening the coronary arteries. This will help increase blood flow to the heart and decrease the amount of work for the heart. So one of the most common antianginal is nitroglycerin. A lot of people have them. So it's used in the prevention and treatment of angina. They're available in many ways. There's sublingual tablets, there's extended release capsules, sprays, patches. Depending on what you're experiencing is going to depend on which one you're going to be using. And if you are experiencing an episode of angina, the first thing you want to do is you want to stop and you want to rest. You don't want to keep going. You're going to place a tablet under your tongue. They're the most common. Or you can do the spray under your tongue and let it dissolve. Make sure that when you're taking it that you are not chewing it. So you want to let it sit there and wait 5 minutes. If you're still experiencing that tightening, that squeezing in your chest, you're going to want to call 911 immediately and get emergency help. For people who already have a diagnosis of chronic stable angina, you want to do it 3 times. So 3 tablets under your tongue every 5 minutes for 15 minutes. If you're still experiencing it, you want to call for help. And it's important that you keep these on you at all times, because angina comes when it wants to come. You don't know when it's going to come, and being prepared is the most important thing. So make sure to keep it in a dark container away from any heat and any moisture. So, and make sure that once you open it that you replace it every 6 months. So another thing prescribed is lipid lowering agents. What are they? They help lower cholesterol levels, especially the bad or the lousy, the LDLs. So how do they work? There are 4 different kinds of cholesterol agents. You have statins, you have nicotinic acid, fibrates, bile acid resins. One of the most common ones that I've seen are the statins. So, and they block the action of the liver enzyme that produce cholesterol. And most of them work in the same way. Either they prevent it, or they lower it, or prevent the reabsorption of it. So, they are most effective when maintaining a healthy lifestyle. You can't expect to take lipid-lowering agents and have this full miracle. You need to actually work on like a proper diet and exercise when you're taking these. I know it's difficult, but they're really helpful and really effective when you're taking them properly. So, and you need to understand the side effects of lipid-lowering agents: heartburn, dizziness, abdominal pain, and don't forget muscle weakness and skin rashes. They're very important. You're going to need to speak with a doctor immediately if you're experiencing them. And also, when you're taking your statins, remember to limit your consumption of grapefruit.
I'll allow that.
Huh?
I'll allow that. There's plenty of other grapefruits out there.
Exactly. That can lower the effectiveness of statins. So just be consciously aware when you're getting those vegetables or fruits and vegetables in. Another thing are antiplatelets. They are medicines that prevent blood clot formation. One of the most common people take, aspirin. And they work by inhibiting the production of thromboxane. That is basically something that helps the cells like stick together. So you don't want them to completely stick together. That's what forms a blood clot and can get you into a lot of trouble. So for prevention, aspirin, like right up there. Most people take an 81 milligram tablet once or twice a day. It depends on what your doctor orders. Sometimes they usually call it baby aspirin. And understanding the side effects and when to seek medical help is important for that, like abdominal bleeding, allergic reactions. So, and maintain your follow-up appointments. It's important not to take other over-the-counter medicines when you're taking aspirin, because some of them actually do contain aspirin in them. So just be consciously aware.
It's funny we still call them baby aspirin because we don't give them to babies anymore.
I know. You should also not take them on an empty stomach. You're fine. And you should be consciously aware when you're taking them about the bleeding issues. So, you know, maybe men, electric razors and stuff. Just be mindful. Don't be going cutting yourself or anything. So, antihypertensives. So what are antihypertensives? They're medicines that make your heart pump better. How do they work? They slow down the heart rate, improve blood flow to the heart, they lower blood pressure, and decrease the workload of the heart. That's what you really want. You want to decrease that workload of the heart. You don't want it to work too hard, because then you're going to get yourself into trouble. The 2 most common are beta blockers and ACE inhibitors. So we're going to talk a little bit about beta blockers. Now, the most important thing when taking beta blockers, it is important to take your pulse reading every day. You sit right here, take your pulse for a full 1 minute.
We're not going to do that now.
Nope. So watch for a pulse below 60 beats per 1 minute. So pump, 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 pump. If you get less than 60 of them in 1 minute, you should call your doctor before taking your beta blockers. They can be taken in the morning at meals or at bedtime, and they can be taken with food to avoid some of those side effects. Helps with the absorption slower. And never stop taking your medication without telling your doctor. So we're going to talk a little bit about ACE inhibitors. They're usually taken on an empty stomach 1 hour before meals. So it's important to remember that because, some of your
So
medications
one's
can
with
be
food,
different.
one's
without
without
food.
food, before the meal.
I know, and that can be really confusing at times. And it's important when you're taking ACE inhibitors to be mindful of your salt and your potassium intake. Because ACE inhibitors keep the salt and the potassium. They're known to
Oh, all right.
keep that in the body, so you want to make sure you don't want your levels to get too high. So again, don't stop taking these medications without consulting a doctor, and if you're going to take any over-the-counter medications, including NSAIDs like Aleve and ibuprofen and Advil or aspirins. And it is important with follow-up appointments with your doctor. You want to make sure that you're checking your blood pressure and you're checking your kidney function. So we're going to talk a little bit about the safe use of medicines. And you could be on many medicines, and sometimes it's really hard to keep them all together, to know what you're taking, when you're taking it. It can be a lot. So some recommendations: keep a list of all your medications in a safe place. You can keep one in your wallet in your purse, one on your refrigerator. Keeping that information on hand can be really important when you're taking medications. So write down all your drug names, why they're being taken, when to take them, how much to take them, and who prescribed them. Because you have multiple doctors, so keeping that in mind can be helpful. You can try using a plastic pill box. Maybe get somebody like a family, friend, or relative that will come with you once a week and fill your pill boxes. Maybe get some help that way. And never hesitate to ask for easy open caps and labels with larger fonts. In the older population,
She looked at me.
maybe you have arthritis and you can't open your pill bottle. Maybe, your eyesight is not so good. So never hesitate to ask. They can be really helpful when you're taking your medications. And another thing you should do is talk to your doctor before starting any other medications, including over-the-counter, like we said. NSAIDs, aspirin, cough and cold medicines, antacids. They're all important when you're taking these medications because they all could have an effect on those medications. Other things are herbal remedies and vitamins. Vitamins, we saw that on Bonnie's slide about taking good care of yourself. Vitamins are great, but make sure that you're discussing these with your doctor beforehand. And some things, play it safe. Do not give family or friends medications that are prescribed to you. And it's also important not to take medications that are not prescribed for you. Do not drink alcohol while taking medications unless it is cleared by a doctor. And of course, do not take medicines that are expired.
All right, and that
Nice.
concludes the nurses.
Yeah.
See you next time.
Thank you.
Bye.
Please, no.